Welcome back to the Build Beyond podcast. I'm your host, Chris Netley. Build Beyond exists to challenge and guide you so that you can reach your full potential. On this episode of the podcast, I'm excited to welcome Dr. Maddy Roth. Maddy is a physical therapist. She has a background in orthopedics, although now she specializes in pelvic health. Maddy owns 3 practices and she's about to open her 4th. And I've been trying to get Maddy on the podcast for over a year. That's how busy she is. I'm super excited that we were able to match up our schedules and I was able to get a little bit of her time. Maddy owns, as I said, multiple practices. She hosts her own podcast. She's a doctor of physical therapy. She's a mom. She's a wife. So she has a lot going on. I don't know a whole lot about pelvic floor PT or pelvic health in general. I know enough to know when I need to refer, though, and I do refer patients to Maddy. Maddy is a cash-based provider. I am also a cash-based provider. So the topic of this podcast episode is discussing why someone with good insurance would even entertain the idea of seeing a healthcare specialist who doesn't take their insurance. Why would someone do that? There are obvious financial benefits to using your insurance. It tends to be cheaper, but what are the benefits when you can establish a relationship with a healthcare provider based on cash pay and not use insurance? Maddy has her thoughts on it. I share my thoughts on it. We have a great discussion. I think you're really going to enjoy this. If you're interested at all in pelvic health or pelvic PT, or you're interested in why someone would pay cash for treatment, this is a great episode for you. So without further ado, enjoy. So I want to start off today. I want to talk about your background a little bit because my listeners, some of them might know who you are, but most of them don't. So Dr. Maddy Roth, PT, pelvic floor specialist. You have a super interesting origin story though, as far as how because you're like super mom. So you've got kids, you're an entrepreneur, a business owner, wife, you know what I mean? Like you've got all these things going on, but it didn't start off like that, obviously. So if I remember the story correctly, you were working in a clinic, a PT clinic, doing just maybe more general orthopedic stuff. And then you
Yeah.
decided to found Inspire Pelvic. So how did that transition happen?
Yeah. Well, it is kind of a long story, but I'll do my best to tell it. And it's kind of hard talking about myself, so I might get a little nervous just telling my story, but um so yeah, I was working for an ortho clinic and I liked it. I mean, I liked ortho quite a bit. After having my son, I started to get more interested in pelvic health. And to be completely honest, I saw it as a way kind of out of the insurance model. And I'm like, oh, people really value this as a cash service. I would love to own a business. And um, so that's kind of, I saw other people doing it, cash pelvic health practices. And I was like, I think I can do this. I didn't really have a mentor, so it was kind of my first patient at my clinic was like my first pelvic health patient, which was really scary. She's giving me $200 and I'm like, yeah, I can get you better. And in my head, I was like, I've never gotten someone better with leakage before, but in theory, I know how to from my textbooks and the courses I've taken. So, and then she got better and it was just like a snowball. But I was met with like a little resistance when I first started. So I worked for that ortho clinic and I was going to go pretty small scale with my business. I had a room rented, got a really good price on it. And I just figured like, hey, I've got to see one patient a week to cover rent. So I'll just, Fridays I have off of work. I'll just see a few patients just for fun. I can kind of do my own thing, keep working ortho clinic. And that quickly changed. I got fired pretty quickly after starting my business and I had no patients and it was just really stressful. Like I went 3 months pretty much with no patients just because no one knew about it. and I was just starting to market it, and it was like very stressful for my family. I actually applied for a couple jobs in the meantime. I applied for the hospital, and like one of the first questions was, have you ever been terminated? Answered yes, and my application immediately got rejected. So I felt like my back was kind of against the wall. So I just had to go all out and kind of swallow my pride and be like, all right, I'm going to do a workshop, even though it's way out of my comfort zone, and just try to get the word out. And then it just started spreading like wildfire. So, yeah.
Okay. So you knew you
Yeah.
wanted to go cash based, or that was something that you wanted to at least test the water trying to do. And that's really actually, that's a nice segue because that's what I wanted to talk to you about, because I'm a cash based provider as well. And I think a lot of times communicating the value to patients of why they would even consider seeing someone and not using their insurance, I think that's kind of challenging. And for the listeners, I'm based in Hillsdale. Maddie's original office is out, or the first office, you have like three now, is out in Saginaw. And I've actually had people from Hillsdale go out there because, so it's not only are they willing to pay cash when they have insurance, but they're willing to pay cash and drive like, I don't know, 2.5 hours, 3 hours to go see a pelvic PT because of a specific issue. So there are a lot of people out there who already understand the value, but I'm always curious to see for other cash-based providers, when someone asks you like, well, why would I not use my insurance? Why would I come see you? How do you even start to explain that to them? What's your
Yeah.
not your sales pitch, but like, I don't know. How do you help them see the value of not using insurance?
Yeah, I think there's so many things. I think I could go on for hours about it. I don't go in that depth with patients typically, but I mean, first of all, it really ups the ante for the clinician and the patient. I think when I was working insurance based, I hate to say it, but I was on my computer scrolling through Facebook. The patients didn't really care. It was free with their insurance. I didn't really care. I had crazy productivity standards, and I was just so burnt out. I was just kind of surviving, and every patient we'd have to put on the bikes so we could work with another patient at the same time and put someone on the arm pulleys. And it was like, oh, this person literally biked to the clinic, and they're asking me, do I need to go on the bike again? And I'm like, yep, you kind of do, because I have to get another patient started. So it's just kind of really sad to see like the extra treatments you have to do that are totally unnecessary, or it's treatments that you can't do that you think the patient needs but isn't covered by insurance. So I think, first of all, like the quality of care is just so much better, and I think the patients are more invested if they're like, okay, yep, I'm handing you my credit card and I'm paying for this. I'm going to do my exercises at home instead of insurance based. I mean, a lot of people, one, aren't getting covered by their insurance, so they just get the bill later like, oh, $3,000, I didn't hit my deductible yet, so I gotta pay all this. But while they were going to PT, they thought it was covered the whole time, so they were just kind of like, whatever, sure, I'll do my ankle pumps and stuff. So I think from the patient side, I see a lot better patient outcomes because I think people are doing their exercises and really valuing it. And then from the clinician side, I even feel a little bit more like, okay, you're paying me, and it's not just for rich people. We get patients of all different backgrounds that like, they literally can't, I don't know, this is hard for them. They're putting their hard-earned money toward this, and if I don't get them better, I'm gonna just be so distraught with myself. So I'm doing every single thing in my power researching, diving in because I know I have to get them better. Like there's no other option when they're putting, I don't know, when they're handing you that credit card. And do you feel that way too, Chris?
Yeah, I think when I talk to people and I say like, well, what have you tried before, and what'd you love and what'd you hate, and usually people have a good relationship with the person. They think, oh, it was a great guy, a great girl. I really liked him. But then when you start to listen to like what they don't like about those experiences, there's a lot of common things. People don't like going and sitting in a waiting room for an hour and being
Mm-hmm.
late to an appointment. They don't like only spending a limited amount of time with a doctor. They don't like feeling like between visits they're no one's thinking about them, or they don't feel like getting cookie cutter plans like, oh, you've got this issue, everyone gets the same thing. They don't like hanging out with PT assistants and not with the PT or with chiropractic assistants, and they just don't like feeling no one want I've worked in clinics where I've seen anywhere from 30 to 50 people a day. You don't want to be my 50th patient on a Friday. I'm not, I probably don't know your name, or I didn't until I walked in the room. You know what I mean? Like there's just
Yeah.
it's not that I don't care. It's just like when you're billing insurance, you have to see an incredible volume to keep a clinic open. And as an informed consumer, with my patients, if they want to go try that and they get the results for a cheap copay, that's awesome. They should totally do that. I would do that. But most
Mm-hmm.
people, I think, when they come in, they don't like a lot of things. And so I'm able to look at all of those things and be like, yeah, I only see 6 patients a day at most, so there's no wait. I don't even have a waiting
Yeah.
room. You know what I mean? There's no overlap. You'll never see one of my other patients, and I'm with you the whole time. And I do think about you in between, and I call you in
Mm-hmm.
between because I build that time in, and it's built into the cost. That's part of like the thing is that like, yeah, if there's a week between visits, you're going to probably get a phone call and a text message and an email from me. All of those are going to happen at some point where I'm going to be curious, and I'll change the plan because I don't have cookie cutter plans, because I have the time, to your point, to look things up and change and be a little bit more dynamic. And it's I think from a consumer standpoint, for a lot of things, I even though we have really good insurance, I am always now I'm more skeptical about using it. You know what I mean? Like, what kind of care are we
Mm-hmm.
actually going to get? If I break a leg and I go to the ER, great, I'm glad I have that. Or I like being able to take my kids to the
Yeah.
pediatrician when they get sick and just paying a copay. But the walking in and handing someone a bunch of your hard-earned money and them taking it seriously and actually being invested in your outcome, it's huge. And to your point, I feel invested in it. And if someone's like paying a couple $100 a session, I'm not on Instagram. You know what I mean? Like,
I
like
know.
I'm here with you right now. Like, this is, I get it.
Yeah.
This is you know what I mean? It's like that transfer of trust. You gave me that credit card, you wrote me that check, you gave me that cash. That represents you trusting me, and that there's a lot of weight that comes with that. But isn't that what you
Yeah.
want as a patient, your doctor to care? You know what I mean? And
Yeah.
it's I don't know. Yeah, I feel like my it's not only do I have more time to care, but obviously there's more incentive because I'm only paid based on outcomes.
Mm-hmm.
Where with insurance, I'm paid based on billing codes. Insurance doesn't ask me how, you know what I mean? Like, they don't really care. It's like
Exactly.
based on the diagnosis, I knew I could get 12 visits, and I
Mm-hmm.
billed as many codes as reasonable within the time slot, and I made the most money possible. And that's it. That's the
Yeah.
game. That's the game. But when it's cash based, if I'm not any good at my job, like no one's going to, like, I have to be swinging for the fences every time someone comes in. I've always got to be a 10 out of 10 energy, and I got to be paying attention. So I feel like it's been a huge shift for me as a provider. I don't know. Is that your experience? Is because you not only did you switch from
Mm-hmm.
insurance to cash, employee to self-employed, but you also switched from orthopedic to pelvic, which I would
Uh-huh.
imagine is a much more personal, like imagine the conversations are a lot more, I don't know. You probably
Yeah.
close the door a lot more than I do when people are
Yeah.
opening up to you about stuff.
Yeah. I will say, kind of going back to the insurance talk, I wanted to add one more thing. I
Yeah.
think when I train my employees, I'm like, this is going to be so different than what you're used to, where you actually have to use clinical reasoning again. Because when you're billing insurance, okay, we got 6 visits for PT, let's get them booked. But now it's like, how many do I actually think this patient needs? And we can like think again and use our brains instead of just. I think that was like, wow, this is weird. It felt really weird at first. Like, okay, I actually think this patient needs a lot of visits. They have a lot of issues, so we're going to book them a lot. Or this person needs maybe just 2 little tune-up visits and they're good.
Yeah.
But back to your question about, yeah, I mean, I think especially in pelvic health, it's really tough to keep up with the insurance model. And I think pelvic health clinics that do take insurance, they're doing a couple different things. So a lot of times they have, it's an ortho clinic that has pelvic as an add-on, because the pelvic health clinic isn't, if they're doing one-on-one sessions, they're maybe breaking even, probably not. They're probably
Mm-hmm.
struggling quite a bit. So they have to, basically, it's just a way they can market, like, oh, we offer this, but they intentionally keep it really small. They don't, that's fine to have an 8-month wait list. They can say they have it. It looks really cool, but they're building their ortho where they can double book, have
Yeah.
PTAs and techs doing all the exercises. I know some ortho clinics that have pelvic health, they try to do kind of a hybrid where like half the session you'll do internal work maybe with the PT behind a closed door, and then they'll come out with the PTA and do like the bike and like
Mm-hmm.
some stretches or something. But they have to get pretty creative, and it's just not possible as a small local business to be able
Yeah.
to sustain that and give like that great experience without, I don't know, foregoing insurance. So
Yeah.
yeah.
And I think the experience is a big thing. That's a good point because it's like the experience is everything. You know what I mean? Going back to what people
Mm-hmm.
hate, they hate that experience of not being heard, spending more longer in the waiting room than with the doctor, feeling
Yeah.
like they're getting the same plan as everybody else. And that's,
Mm-hmm.
I think that's like it's an interesting thing because it's, you could say like, well, it's more efficient. So when someone has like a rotator cuff problem, we just do the same thing for every rotator cuff problem. Why wouldn't that work? Well, everyone's got a different goal, right? Even if they have the
Yeah.
same injury, and that goal is their destination. So everyone's going a different place, and everyone's starting from a different place. So it's like
Mm-hmm.
you're just gonna use one roadmap and give it to everyone. You know what I mean? With that same injury, like yeah, there's a certain percentage it's gonna fit. You know what I mean? But what if you're starting at a different spot, or what if your endpoint's different? And I feel like that's insurance. That's an insurance model
Mm-hmm.
because that's the only way you can survive. You have to be as efficient as possible, see the highest volume possible. So you can't think and
Yeah.
change very much. And so you have to make everyone fit your model rather than you think and fit their circumstance. And I feel like that's
Mm-hmm.
the that for what I do, that's the difference is like I don't like I could see all low back pain patients in one day and it's going to look and if you watched everything looks different because everyone's got different goals and they're starting from different spots and they have different lives and there's different things going on. Yeah, it's like everyone might have an L5 disc problem, but it's they need something different, and
Yeah.
so that's what you don't get with insurance providers, and I feel like there's nothing, that's not because they're bad PTs or bad chiros or bad people. It's just like insurance doesn't reimburse you for thinking. You know what I mean? Like
Mm-hmm.
you got to justify alphanumeric codes,
Yeah.
you know,
Yeah.
and
And it's
that's
kind
it.
of like, well, you know what? We have 6 visits. We'll see how much we can get done. But there's no, I mean, I like people. I want them to get better. But it was kind of like, like where we are at 6 visits. We did our best. But this is like people are basically coming until they're better. So, and we want to get them better as fast as possible. So I think
Yeah.
it's just, there's never wasted time. And it was getting so at the ortho place I was at, all I was doing was new patient evals. So I just really missed having the patient bond experience where like patients were coming in and I was a little jealous because I would be bringing like the texts like, oh, I brought cookies for you. And it's like, I designed your whole plan of care, but you don't even know me at all. Like, I'm just doing eval after eval because that's like the most profitable way to do it. But I just felt like I was seeing new people all day long. I would never continue a relationship, and I really value that. So that's been really nice with this model.
Yeah, you get to know your patients. That's cool. You know, I think that's probably another benefit of it is not only do I know people's names now, but you know what I mean? Like, you know what was going on last week, and you know what's going on this week, and you know what, you know, you just have that time with them, which is
Yeah.
valuable. I think that helps with compliance because it's not like, oh, this nameless person told me to do this stuff. You know what I mean? It's like, no, Maddie, my friend, you know what I mean? Like she, you know, there's that connection, and I feel like people are, it's just human nature. They're more likely to go along with that or be honest with you and be like, I don't really like this, or I don't understand what's going on. But if they don't know you, they can't be like, this isn't working for me, or they'll just
Yeah.
drop out, and you won't know why, you know, because you don't
Mm-hmm.
have that communication.
Yeah.
Who's
Yeah.
what's
And
your ideal patient? Like,
oh,
who do you love to
so
work with?
I would say our clinic's ideal patient, our most common and that get awesome outcomes are people that have leakage and prolapse, pain with sex. Those are kind of our 3
Mm-hmm.
major diagnoses that we treat. But I would say for me specifically, I like the weird ones. And I know you kind of talked about how you're like that. You like the really complex ones. But I like the weird cases. Like, we don't get constipation quite as much as like leakage. I love a good constipation case. Or interstitial cystitis. Oh, I lost you.
Can you hear me now?
Yep.
Yeah, it cut out for a second.
Yeah, I
That.
lost you
I'll
for a
edit it
second.
out or just leave it
Okay.
in.
Where did you lose me at? Where should I start?
So you
Or
had your
should I
top
just.
three. Yeah, you had your top three, and then that you see at the clinic, but then you like the
Okay.
weird ones. But then you were gonna
Yeah.
qualify what weird meant.
Losing you again.
Yeah, it's probably an internet connection.
Yeah, I think it's me. Okay. So, anyway, yeah, I really like treating interstitial cystitis. I think that's
Hmm.
a really interesting one. So, that's like, it kind of mimics a UTI where people feel like they're having UTIs, but it's more of a pelvic pain condition. And
Yeah.
it's something that has really good research for pelvic PT. So it's just really fulfilling to see those types of patients, see urologists, do all these meds and all this stuff, and it just never works. Then they come to pelvic PT and it's like they are doing so much better. So yeah, I like those kind of weird ones, and we usually don't turn patients away. Even if it's something maybe we haven't seen, we're just pretty honest with them. Like, you know, we had one person that she was coming because she had like an itchy vulva. And we were like, okay, we're going to be completely honest. This could be a dermatological thing. It could be an STD. Like, we think you should do all this. And she's like, I am not going to go that route. I just am not trusting in the medical system. So, anyway, we're like, okay, the only way this is going to get better is if it's a nerve issue and that's what's causing like this itching and burning, and we're going to treat it as though, but we're not guaranteeing results because this is a very odd case. And she actually got 100% better doing different nerve releases of the pudendal nerve. So I was like, okay, I'm glad we took her on because it really changed her life. But I was like, ooh, this is not a typical case. So
Yeah, that's interesting. I bet you get a lot. I bet you get some of those. I don't know. So for me, it's like knee pain, back pain, shoulder pain.
Mm-hmm.
You know, you get
itchy vulva.
Yeah, no one's ever come to me with that one.
So what cases do you like?
I like, well, from a joint standpoint, I like injuries that I've had. So I love shoulder patients. I love ACLs. Like, and I think that's something that chiropractors don't typically work on those, but I love post-op ACL. I have one right now. I'm having so much fun with it. Like getting someone right after surgery, especially athletes, and working them back is super fun. I mean, it's really rewarding. They work really hard. So like those are like high energy sessions, and you know what I mean? Like it's just a fun population to work with. I like low back pain and stuff like that. I think that like the only things I don't like, I don't like working on people's mouths. Like I hate TMJ stuff. And wrists are really tough. Wrists and hand stuff. I feel weird about that too, because it's like if I'm not good at it, and if I'm not good at it and you mess up someone's jaw or you mess up someone's hand, I don't know. Those are stuff that I really like to co-manage.
Yeah.
You know what I mean? So if it's a wrist thing, like if it has to do with your elbow, I got you. But I also like to have that. I don't know. I like the co-management with certain things like that. But I think in general, regardless of the issue, I like working on stuff that I like being the last provider. You know what I mean? I love it when someone's like, nothing works. And I'm like, okay, one, I can't screw up. So it's like, like I can do worse than everyone else has already done. Two, I already have a ton of information based on what's worked, what hasn't worked. But also those people are usually the most committed. And to be fair to the other providers, because it's usually I'm competing with insurance providers, they didn't cross every T and dot every I. So after about an hour talking to someone, those impossible cases that can't be solved, it's like, I've got a top three where if we can correct these, this is probably going to go away. You know what I mean? And it, I've had people just like, I was like, oh, you have sleep apnea. Like you need to go get a sleep study. And then they're like, oh, I'm sleeping better. And my low back pain went away, and it's like, so sometimes there are those types of things where I'm looking at them like, this isn't even like an orthopedic problem. Like there is something else going on, and I don't even have to do anything. I just have to connect them then with someone who and then it's this layup, and then some other provider just dunks it. Yeah. But it's like I get to be a part of that. So I don't know. I think I've had a lot more fun working with people who are like, no one can figure this out. And it's not like I have a superior intellect like some TV show. It's just like I just literally go back to basics like I'm in grad school. Like, I don't know, what does active range of motion look like? What does passive look like? What does, you know what I mean? Like you just start like going through like, I've got time. Let's just be super systematic. And then like asking tons of questions and asking even more questions and getting a little bit deeper, and then going outside of orthopedics and sleep, nutrition, trying to get an idea of what's going on, with the whole person. And then you step back and you look at it and it's like, oh, you're not sleeping well and you're going through a divorce, and you're stressed out and you have depression and you don't think your medication's working that well. And you had this injury before and this has been going on for a long time, and someone noceboed you because they said you're going to need surgery. You know what I mean? Like you start stacking up all these things and it's like, your doctor told you it was in your head and that it's not real. And it's like, yeah, no wonder you're in pain. I'd be shocked if you weren't in pain. Like we've got a list
Yep.
of 10 things. What do you want to start with? And then it gets real easy. Like because I have time, so I just let them pick. Like, okay, well, let's do that, and then we'll just kind of prioritize based on what you want to work on. So I think from an orthopedic standpoint, if I have time, which I do, and people are open to doing something different, it gets simple real quick. It's never easy because it's like, yeah, this is going to be 6 months of pretty regular rehab. Like some of my plans,
Mm-hmm.
it's like, dude, you're going to rehab 5 times a day for the next 6 months. And if I can get you to do that, like we get a little bit more protein, a little bit more fiber, and some better sleep. You know what I mean? Like in 6 months, you're going to feel amazing. And
Yeah.
people, and so like those impossible cases all of a sudden become very simple. And I think that's like
Mm-hmm.
providing that kind of clarity is pretty fun. And I would imagine for what you do, people come in with all kinds of ideas. Because I do screening
Mm-hmm.
questions for women for pelvic health because like if a young woman has low back pain or hip pain, I've never met her. My differential diagnosis is like, I don't know, maybe it's an ectopic pregnancy. Like I have no idea what's going on in
Yeah.
that region. So I ask a lot of those questions and I don't get a lot of confident answers sometimes. You know what I mean? Where it's like, I
Mm-hmm.
don't know. Yeah, my cycle is usually off. I don't know. It's never really, I've always had unusual pain with that. Or and
Mm-hmm.
women sometimes will open up to me, and it feels like I'm about to open up Pandora's box. And it's like, okay, well, we, I like, I'm glad you want to talk about that. That's something we
Go
need to
see
look
Maddie.
into. Yeah, I need to get you to an OB or a PT. Like we need to like there's
Uh-huh.
some other bigger thing there. But all that stuff is fun. It's fun helping people solve the problems, which
Yeah.
I think is probably like my favorite part of the job. But what
Yeah.
I'm curious what because you've been a PT in different specialties. You know what I mean? Like orthopedic,
Mm-hmm.
pelvic. You've been insurance based. You've been cash based. You've owned a practice. You've worked for people. Out of all those experiences, what's your favorite thing about being a physical therapist? Just big picture.
Yeah. I always kind of say I don't really even care what the diagnosis is. Like, I liked ortho, I like pelvic. I just really enjoy working with people. I like learning from people, and that's probably my favorite part. My favorite part like in a session or about the job, I guess, is I like being on my feet. I like moving, and I really like doing crazy stuff with my patients. Like when I worked ortho, it was so rigid and structured. Like, okay, we
Mm-hmm.
we do the bike, then we do like long arc quads, short arc quads, or whatever, and or if it's a shoulder, then we do the arm ladder, the pulleys. It was so like the treatment was always the same that now I'm like, you're leaking with volleyball, like let's go play volleyball out in the grass. Or you're a marathon runner and you leak on mile 8, like guess what we're doing today? I'm going to look at your running pattern and I might even have them run like 4 miles or 8 miles in a session, like because a lot of people have been to pelvic floor therapy and they're like, yeah, like I think it helped. I don't really know. Like they did mat exercises, but if you're
Mm-hmm.
leaking when you're powerlifting 300 pounds, doing mat exercises don't even come near to like
Yeah.
testing that or preparing you. So I really like analyzing people's form and looking at the biomechanics of like why that might be causing a force transfer issue to their pelvic floor, correcting their form, and just magically their heaviness or their leakage goes away.
Yeah.
So, yeah, the people and just getting wild and doing weird stuff outside of our of our building on
That's
Fashion
fun.
Square Boulevard, right across from the mall. So people are like, "What are they doing over there?"
What's your least favorite thing about physical therapy?
Um,
I'm putting you on the spot, I know, but
yeah, I don't think it's a bad question. I think it's the level of respect PTs get isn't super great, and I don't
hmm.
mean to sound like I'm on my high horse, but for example, we have a patient right now, and my clinician came to me. She's like, "Oh, I'm just struggling because this patient, I know I can get her better. She has prolapse. It's not that bad, but her surgeon, like her gyne said, like, it's not gonna work. You need this surgery." And we're like, there's good research. Like, I know we can get her better, but always the physician or MD's word gets just a little higher than ours. So often the patient will follow what their surgeon says over what we would recommend, which is kind of hard. I mean, some patients will be like, well, let's try it. But it's hard to be respectful of other professions, but also not be like, oh, like I know we can get this patient better. This is just so devastating to see this person go through an unnecessary surgery for something we know we can fix. And we'll sometimes say that with intensity, but they're still like, well, I don't know. My doctor, or the doctor will say, like, don't go to pelvic floor therapy. And we've actually had a patient just stop coming because her doctor said, like, it's not going to work. It's not worth your time or money. Mm-hmm. And it's just really frustrating.
Yeah. That's frustrating.
Yeah.
But I would imagine you still have a pretty good referral basis, like the relationship, because PT is so integrated, I think so well integrated with the medical profession, that there's got to be a lot of physicians out there who are like, who love PT. You know what I mean? Like, I feel like as a doctor, if you're a physician and you don't have time and you have a good PT to refer to, you know, that's all those wins that the PT gets are your wins. You know what I mean? So
for sure.
I would imagine you have some good relationships with people.
Yeah, we definitely do. I think it's not really the type of discipline. It's just the type of person, whether we had a guy that was referring to us a lot, and he was like, yeah, when I was doing my residency, the lead doctor, he always referred to pelvic floor therapy, and I just was like, whoa, his patients were getting better, and now I always do. And we've got a couple really great ones in town that we know are always referring, like, all day. So I think part of it is just the barrier that, I mean, still people don't know a lot about pelvic floor therapy, even, I mean, patients, but also physicians, like, think all we do is Kegels, and like, that's not going to help people. So as a chiropractor, do you guys typically have physician relationships, or is it more direct patient marketing?
So historically, chiropractic has roundly rejected the medical profession, so, like, aggressively. And I feel like there's a good reason for that back in the 1800s. And the American Medical Association, I don't know, maybe it wasn't the AMA at the time, but physicians came after historically came after chiropractors at one point. And so there's always been this, like, animosity. And now, I mean, we actually chiropractic has never had a chiropractic school within a major university. And the first one just opened up in Pennsylvania, and I think out of their medical school, like, it opened up this year or last year or something like that. So it's taken over 130 years, but it hasn't, I honestly feel like it hasn't been so much of the medical profession saying, we don't want to play with you guys. It's been the profession being like, we don't want to, like, we're better than that. And there's a little bit of, I don't know. It's ironic because I feel like our profession was founded by a bunch of free thinkers who were looking at what was going on at the time and being like, there's got to be something better. And now the profession is dominated by people who idolize those free thinkers, but will not think freely for themselves. You know what I mean? It's like the founders of chiropractic had limited knowledge. Like, MRI wasn't invented at that time. They didn't have all of this research. So if you could travel back in time and bring the founders of chiropractic to the present day and give them 6 months to study, I think they would change their mind on a lot of things. I would have
Yeah.
to I have that belief that they're open-minded enough to realize, to appreciate that what they created still exists, and there are some things that have stood the test of time, but like 75% of what they came out, what they thought, their theories were just wrong. There's no shame in that. But oddly enough, our profession, we just like cling, not the whole profession, but there's still too much of it where people just cling to like what some guy in the 1800s thought was going on, and it's like that's just, and we use it historically as justification for care, which is like historically it's interesting, but when patients come in and they have been told certain things, it's like ugh. And I think that's what rubs MDs the wrong way. To go back to
Mm-hmm.
your question, is like when they hear that stuff, they're like, it's not like I don't want to send patients there, and I get
Mm-hmm.
it. I'm the same
Mm-hmm.
way. It's like I don't, if someone's like, "Oh, I have back pain. Should I see a chiropractor?" I'm like, I don't know. It depends on where you go,
Yeah.
because I don't know what, like, we're just not. I don't want to say we're not well regulated, but there's a lot of variability. Like, there's no standard of care,
Mm-hmm.
um, which is a good and a bad thing. It's a good thing for me in a way because I get to do whatever I want within the
Mm-hmm.
scope of my practice, which means that I get to practice a little bit more of like a PT or like a strength coach. I just spend a lot more time doing active care and a lot less time doing passive care.
Mm-hmm.
And I think from my interaction with physicians, they like that more. At
Mm-hmm.
least I'm starting to get a lot more referrals and having better relationships with physicians because, they're like, well, I have a diagnosis. How is manipulating that joint going to affect that diagnosis? You know what I mean?
Uh-huh.
Like it doesn't make sense to apply that to everything. You can't just
Mm-hmm.
crack everyone's back and heal someone's knee. Like that doesn't make any sense. But that is like the standard, or it's the standard of care, at least in this area for chiropractic. So when I get to talk to a physician and be like, oh no, like I would probably never manipulate that patient,
Uh-huh.
or what do you think? Like, what would you do? And then I get there. I love it when a physician's like, well, I would do this. I'm like, okay, I'll start with that then. Like, I don't, you know what I mean? Like,
Mm-hmm.
we'll try it. Might as well, if you think
Yeah.
you're going to get results with that. So I think our relationship with physicians is complicated, and I think it just depends
Mm-hmm.
on the individual provider. But you'll walk into some chiropractic offices around here, and there'll be posters up that are, or paintings or phrases that are slightly derogatory towards the medical profession, and they date back to the 1800s. But it's like, why? Like,
Mm-hmm.
why are we antagonizing? Like, this should be a better relationship than what it is. So, and I think maybe our relationship with DOs is maybe a little bit better because
Mm-hmm.
they have, kind of a wacky origin story too. Not talking trash about DOs, but I'm just, if you're a DO and you listen to this, you know what I'm talking about. I'm not saying it's bad. I'm just saying, like, we come from like we're cut from the same cloth. But to the DO's credit, like osteopaths at some point were like, hey, we should learn from science and
Yeah.
change. And like podiatry is the same way. I think they have kind of an interesting origin story, and but they were
Uh-huh.
like, okay, we need to adapt. And chiropractic has just been like, we've been sitting here with our arms crossed for over 130 years, being like, we're not gonna play with you guys. And I've been like, okay,
Uh-huh.
fine, we're not gonna send patients to you. So I think it depends on the individual provider. Where I feel like
Mm-hmm.
that flow of patients between PTs and physicians from the outside looking in seems to be a bit smoother. They
Yeah.
seem to be a bit more trusting of you. Like sometimes I feel like if I had PT behind my name, I wouldn't have to try so hard to convince people that this was going to work, because they're like, oh, what does
Uh-huh.
a chiropractor know about that? And it's like, I don't know. Like I just do it a lot. You know what I mean? And like
Mm-hmm.
I talk to people. So for like ACL stuff, we didn't get taught that in school. I mean, I have all the general anatomy. I know the general stuff with rehab. I just started contacting PTs who do post-op ACL rehab, when I
Mm-hmm.
had my first patient, and was like, what protocol do you use? Like, what do you, and I just got a ton of info,
Yeah.
and you just make that work. And it
Mm-hmm.
seems similar to like what you kind of did with pelvic health, where you're like, I don't know, I got a patient in front of me who needs to get better, and I care enough to research them
Yeah.
and to help them. And it's like, oh, it's actually quite simple. We just follow the steps, listen to their
Mm-hmm.
goals, and then do what they work, move them in the direction that they want to go, and make sure you follow the surgeon's guidelines. And if you're organized, it's not really that complicated. So I think, I don't know. I'm hoping that our profession moves more in the direction of playing nice with the greater healthcare system, especially with PTs, because that's an interesting relationship where
Yeah.
I've heard so much. Before I became a chiropractor, I thought PTs and chiros like got in fistfights just because like
Uh-huh.
I never saw them together. And every time I talked to a PT, they're like, and I brought up chiropractic, it was like, don't even, don't even mention that in front of me. Like
Uh-huh.
they're quacks. And it's like, and I get it. I don't understand where it's coming from. I think some of it's a little bit dramatic, but like that relationship, I think is interesting. It's been fun as a chiropractor to hang out with PTs more often because we see the same
Mm-hmm.
patients at least in orthopedics. It's like, it's the same
Yeah.
people. They have the same
Yeah.
complaints. And
Yeah.
so like when I look at what PTs do for a lot of stuff, it's like, I don't know, what do you do for an ankle sprain? Oh, it looks cool. I'll do that. You know what I mean? Like that's good.
Mm-hmm.
You know what I mean? And I think the relationship for some of us, depending on the way we talk to people, is improving. I hope.
Yeah. Yeah. I think it is. I don't know why, but it seems like when I worked in the insurance world, I really felt that tension. It was like we're really in competition with the chiros, like they're going to either do PT or chiropractic. But now being in the environment that I'm in, it's like it's more about being a holistic treatment plan for our patients, especially in pelvic health. Like
Yeah.
they really need chiropractic and PT and probably their dietitian and I don't know, even their primary care. Like they just need a little bit of everything. And I think like we help kind of put the pieces together. Like, no, it's not like it either one. You kind of need to be seeing both of us when you're pregnant and postpartum.
Mm-hmm.
It seems like it's been more of a partnership now, being in this setting that, like, wow, we actually really complement each other. We're not really necessarily always doing the same things. They have different strengths than we do. So it's been cool.
Yeah. I talked to a PT one time who was in a PhD program, and he had an interesting thing because he's like, if you're gonna go see a physician, do you care if it's an MD or a DO? Like, you don't. No one cares. You know,
Uh
as long
huh.
as they're good, no one cares. So he's like,
Yeah.
for orthopedics, for chiro and PT, what if we could get to a point where like we have our own unique backgrounds and education, but from the patient's perspective, should they care? Should it really matter?
Uh
It's more
huh.
about the person. Like, is that person, regardless of the letters behind their name, do I think I'm going to work well with them, and do they feel confident that they can help me? And then is
Mm-hmm.
that person following the basic guidelines, for orthopedic or pelvic health? You know what I mean? Like, it's like, because that's a lot of things.
Yeah.
Like, if you look at, like, if you go to the American Chiropractic Association's website and you look up low back pain guidelines, you'd be shocked because there's two papers, and one of them is from the American College of Physicians, or it's some medical thing talking about the guidelines for low back pain, and the other one is a paper written by chiropractors and PTs, and they both kind of mirror each other. And like, I think they break it down into like could do stuff and should do stuff. Well, getting your back cracked for low back pain is a could do. You could do
Mm-hmm.
it. You shouldn't. You don't
Mm-hmm.
have to do it. And so when I look at like chiropractic offices that treat low back pain, and they manipulate, and that's basically all they do, and they go, well, we're evidence based, and it's like you have a very like if it like how many things can you take away from the guidelines and still be evidence based? You know what I mean? Like, you're taking something that they're like, yeah, do it if you want. It's not really like, it's fine. Like, if it helps someone, great. But what are
Uh-huh.
all these things you should be doing? Like doing a thorough history, doing a thorough examination, promoting physical activity, doing rehab, like all like nutrition, sleep. Like, there, all these things are in the guidelines for low back pain, as like, no, this is like you need to be doing these things. And so I feel like with chiropractic, at least, a lot of people will strip away everything they don't want to deal with and then pull out the one thing that they like to do. And it's like, well, it's not really holistic care, to your point. Like, you're just,
Mm-hmm.
you have one hammer and you got to justify hitting everybody with it. And that's how you make money. And it's not holistic. And I think, not throwing stones at PT, you guys have a similar issues with certain people where it's like everyone goes and gets on the bike and then gets E-stim and then, you know what I mean? Like the stereotypical thing, but like
Mm-hmm.
I talk to people and like that's what they get. And it's like, oh, that's weird, because everyone who comes out of that clinic does this, like has that same protocol for the most
Uh-huh.
part, you know, and it's like, that's not holistic. That's just, again,
Yeah.
they have a different type of hammer, you know. So if you've got low back pain and you go to if you go to a PT clinic, they've got this type of hammer and that's all they have. And if you go to the chiropractic office, they have this type of hammer and they've got to make you look like the nail that'll fit that hammer the best. But you know what? If you went to a mattress store and complained about the same low back pain, they'd probably sell you a mattress. You
True.
know, and if you went to a shoe store, they'd sell you
Yeah.
shoes. So it's like, I feel like with cash-based providers, that's why I like sending my patients to places like your clinic. It's like, I know you're not going to try and sell them anything specific. They have a
Mm-hmm.
problem and you're going to try and solve that problem. Like, it doesn't, whether that means they're going to go run an 8 mile for time, or they're going to be playing volleyball, or they're going to be back squatting 300 pounds,
People
or
are
you're
gonna be
doing,
scared to come.
yeah, or you're, you know, putting on rubber gloves and doing an exam.
Yeah.
Like, I don't know what you guys do, but it's like, I just know that it's like, if someone's like, well, what's it going to be like? I'm like, oh, I have no idea. I don't have,
Yeah.
like, I'm not a woman. You know, I'm talking to my women patients, and it's like, even for the guys, I have sent at least one male patient to you guys, and it's like,
Mm-hmm.
I don't know. Like,
I can't
I'm,
even
I'm,
imagine.
I'm curious to, you got to tell me. Like, I've never had it done. I've never had a reason to go, but like, I'm
Yeah.
fascinated to, if you want to talk to me about it. So,
Yeah. I mean, I think there is such a variety in what we do during
yeah.
sessions. Like I talked about kind of the high level stuff, which I can you hear me okay?
Yeah, it's just breaking out a little bit. It usually works out though when we edit.
Frozen.
It's just a little choppy. Oh, now it's out.
Okay, we had some tech issues, but I'm back on. Just wanted to finish my thought. So, yeah, I talked about that our treatments can be high level, like playing volleyball outside with a patient, but that's not what it is like for every patient. Some patients were literally just talking for the whole session. Some patients, there's more of the psychosocial component that is playing into their symptoms. Other patients were doing really basic, just breathing exercises, and those have a huge impact on their pelvic floor and their symptoms. So I also want to let people know that we don't just treat athletes, we treat people of all ability levels, and we meet you where you're at and tailor it to your body. So I would love to come on again, Chris, and go through kind of different treatment techniques that we use. And I'd love to hear from you too on what types of treatments you like to use with your patients. What have you found success with different cases? It'd be fun to go case by case. But thank you so much for having me and for all of your time. I really appreciate you inviting me to come on the show. It's been a great chat. If you want to find me, our clinic is Inspire Pelvic Therapy. You can find us on Instagram, Inspire_Pelvic PT, or on Facebook, Inspire Pelvic Therapy. Our website's www.inspirepelvicpt.com. And we treat patients, kind of like Chris was saying, all throughout the state of Michigan. And we're adding clinics pretty quickly. Our goal is to spread across the US. So if there's not a clinic near you now, hopefully there will be in the future. Thanks again for having me on.
Unfortunately, Maddie and I experienced some technical difficulties and we didn't get to finish the episode. I'm going to link all of Maddie's contact info in the description. Her practice is Inspire Pelvic Therapy and her podcast is The Dr. Maddie Show. I hope you enjoyed this episode. Thanks for listening.